Welcome back to our YouTube channel MD Nursing Education. Today we are going to discuss about Hyperemesis gravidarum, and those who are new in this channel, please subscribe the channel and like the video. So let's start. In this video, in this lecture, Hyperemesis gravidarum, we are going to discuss about introduction, definition, incidence, etiology, changes in the body and clinical manifestation, diagnostic evaluation, complication and management of Hyperemesis gravidarum. So let's start. Hyperemesis gravidarum. Hyper means excessive. Hyper means excessive. Emesis means vomiting and gravidarum means during pregnancy. So the meaning of hyperemesis gravidarum is excessive vomiting during pregnancy. So normally in normal pregnancy also woman is having nausea, vomiting. That is normal. Okay, so if it is normal, then we call it as emesis gravidarum, means vomiting during pregnancy. But if it is excessive in high amount, or if its intensity is high, then we can call it as hyperemesis gravidarum. Okay, hyper means excessive, emesis means vomiting, and gravidarum means during pregnancy. Excessive vomiting during pregnancy is called hyperemesis gravidarum. And this nausea, vomiting, if it is moderate, or we can say if it is less amount or less quantity, so it is normal. It is normal until about 16th week of pregnancy. Till 16th week of pregnancy, there will be, because of morning sickness, because of change in the hormones, so nausea, vomiting will be there. That is normal. But intractile nausea, vomiting, intractile means which we can't control, which is hard to control. So intractile nausea and vomiting leads to fluid and electrolyte and acid base imbalance. So if it is severe kind of vomiting, that means if it is intractile, which is hard to control, it will lead to fluid and electrolyte and acid base imbalance, nutritional deficiency, because when the woman is eating, if she eats also, then because of vomiting it will come out. So nutritional deficiency will be there, and weight loss during early pregnancy, and there will be weight loss in early pregnancy, because the woman, when she eats anything, she vomits it. So when she will vomit everything, so there will be fluid and electrolyte imbalance, and the weight loss will occur, because digestion will not be there, the food will not be absorbed, it will be vomited out, it will be vomited out. So next is, if we see definition of hyperemesis gravidarum. So it's a severe type of vomiting. Hyperemesis gravidarum is a severe type of vomiting which has got deleterious effect. Deleterious effect means harmful effect, which has got harmful effect on the health of the mother and incapacitates her in day-to-day activities. Incapacitates means which makes her difficult, which makes her unable to perform the daily activities. So what is hyperemesis gravidarum? Hyperemesis gravidarum is a severe type of vomiting which has got deleterious, or we can say which has got harmful effects on the health of the mother, and incapacitates means making difficult for the mother to perform the day-to-day activities, So when severe vomiting is there, severe kind of vomiting, so there will be fluid and electrolyte imbalance will be there, acid base imbalance, nutritional deficiency, weight loss, that will affect the health of the mother, and severe complications can also occur. Okay, so that's about introduction and definition of hyperemesis gravidarum. So next we will see about incidence. So incidence, third one is incidence. Incidence is 1:1000, or we can say less than 1. Less than 1:1000 means among 1000 women, one woman, less than one mother suffers from hyperemesis gravidarum. Incidence is less than 1 among 1000. In early this one life that time, no, in early years that time, people, more women were suffering from hyperemesis gravidarum. Now the incidence has reduced because of high facilities, then high education, women are educated, and planned pregnancies are there, no unplanned pregnancies. So because of so many this one new trends in the medicine, in the medical field, now everyone is aware of this, and new medicines, now medicines like antiemetics, so when they are controlling the hyperemesis gravidarum in early stages, that is why the incidence is less. So incidence is less than 1 woman among 1000, means if 1000 women are pregnant, 1000 among them only one woman will have this hyperemesis gravidarum. Okay, so that's about incidence. Next we will see the causes of hyperemesis gravidarum, or we can say etiology means causes. So the etiology of hyperemesis gravidarum is based on theories. It is theory based. The cause of hyperemesis gravidarum is theory based. In that, first one is hormones, or we can say hormonal. In that, hormonal rising of HCG and progesterone, rising of HCG and progesterone, which are elevated in the first trimester of pregnancy, means in hormonal, the human chorionic gonadotrophin HCG and progesterone, the level of these will increase. Elevate means increase in the first trimester. First trimester means first 3 months. 3 months of pregnancy. So there are 3 trimesters, 3. Okay, 9 months of pregnancy. So hormonal means one is HCG, human chorionic gonadotrophin, which is released from the placenta, the chorion. And so what it will do, when it increases, normally the level of HCG will be normal only, but due to hydatiform mole is one type of condition, that is tumor of placenta, or we can say that abnormal cyst formation in the placenta, hydatiform mole, and multiple pregnancy, means more than one fetus is present inside the womb. So that time the level of HCG, human chorionic gonadotrophin, will increase, and when the level of HCG increases, it will induce the nausea and vomiting. Okay, second is progesterone. Progesterone is, these both are secreted during pregnancy. Progesterone maintains the pregnancy, and what it does, it causes the sphincters, it loses the sphincters, that is gastric sphincter, so we can say esophageal sphincter, so pyloric sphincter. So this progesterone, it decreases the motility, gastric motility, it decreases, and it this one loses the sphincters. So that will cause the backflow of gastric content, that will cause the vomiting. That's about hormonal. Usually HCG, human chorionic gonadotrophin, and progesterone. So when their level increases in the blood, they will cause the vomiting, nausea, vomiting. Second one is psychogenic. Psychogenic is related to our mind, neurogenic. So how it affects, means when the nausea occurs first time, when first time nausea occurs to the mother, so the perception of mother changes. So then she thinks, after that, once it occurs, then the mother thinks that I am having nausea. Continuously thinking about that will cause severe nausea and vomiting. That is called perception. See, it probably aggravates nausea once it begins, means once it begins, excess perception. When the mother is thinking again and again of the same thing, that I am having nausea, so that sensation will cause more severe nausea and vomiting. That's about psychogenic. Third one is dietic deficiency. When the mother is not taking proper diet, that means deficiency of vitamin B6, vitamin B1, then carbohydrate, low carbohydrate, and protein. So deficiency of these items like vitamin B6, vitamin B1, then carbohydrate, protein will lead to nausea and vomiting, will lead to hyperemesis gravidarum. And last one is decreased gastric motility. So when the level of HCG, progesterone, when the level of progesterone increases in the body, in the mother's body, that will decrease the motility of the that will decrease the gastric motility. So with that, low peristaltic movement will be there and the nausea vomiting occurs. Okay, so these are the causes of hyperemesis gravidarum: hormonal, psychogenic, dietic deficiency and decreased gastric motility. So known facts about hyperemesis gravidarum. So first one is common in first pregnancy. Hyperemesis gravidarum is common in first pregnancy. Second one is occurs in first trimester. So it occurs in first 3 months of pregnancy. Third one is also seen in multiple pregnancy. Multiple pregnancy in the sense that if in the woman's uterus, if more than one fetus is present, so in that case also it is common. Then occur in mother having familial history. If the mother is having family history, means if in their family someone is suffering, like if this one mother's mother was suffering from same thing, so she may also get this hyperemesis gravidarum. That is family history. If anyone in the family is suffering, she may also suffer from this. And then more common in hydatid form mole. So hydatid form mole, as I already told, it is the cancer, or we can say tumor or cyst formation in the placenta. Okay, so that can cause this hyperemesis gravidarum. Because of hydatiform mole, more HCG, human choriogonadotrophin, will release and that will cause the nausea, vomiting. Then more common in unplanned pregnancy. More common in unplanned pregnancy means when there is no gap between one pregnancy to another. For example, this year the woman was pregnant. Now she has to plan the pregnancy that she should take 1 year or 2 year gap for next pregnancy. When there is no family planning, when there is no planning, that can also cause hyperemesis gravidarum. Understood? So next we will see the changes in the body due to hyperemesis gravidarum. So in that we will see. First we will see biochemical changes. What changes will occur in the mother's body. So first, excessive vomiting. Because of excessive vomiting, what will happen? Loss of water. Excessive vomiting, loss of water and salt. When there is excessive vomiting, it will lead to loss of water and salt. What salt? Then that will falls in the levels of plasma sodium, that is hyponatremia, plasma sodium, potassium, hypokalemia, and chlorides, hypochloridemia. So excessive vomiting will lead to loss of water and salt. Then because of that, fall in levels of, means the level of these will decrease, that is sodium, potassium, chloride. So these salt, their level will decrease. That will lead to electrolyte imbalance. And in turn dehydration. That will lead to dehydration. Because of this, hepatic dysfunction will occur. Hepatic dysfunction. So space was not here, that's why I have written here. I will tell, you can just copy. Hepatic dysfunction. When there is hepatic dysfunction, when the liver is not able to function properly because of this one water and electrolyte imbalance, dehydration, that will lead to acidosis. Okay, that means the acid level will increase in the body. Then ketosis. Ketosis means when the body uses fat for the energy. Means ketone bodies. There will be release of ketone bodies. Ketone bodies, when they are released, when the body will use the fat for energy. When there is no energy, when there is no carbohydrate, then the body is having the fat. So this one body will utilize that fat only. That fat, when the fat will be broken down, it will lead to release of ketone bodies, and that will cause the ketosis. And last one, rise in uric acid. When there is no urine formation, when there is oliguria, or we can say that when the woman is unable to pass the urea, then that will lead to rise in uric acid levels. Okay, so when there is hepatic dysfunction, hepatic dysfunction will cause hypoglycemia, decrease in the glucose level in the blood or in the body. Hypoglycemia, hypoproteinemia means decrease protein, because when the woman is not eating anything, when she is eating, she is vomiting, so that will cause the hypoglycemia, less glucose level in the blood, hypoproteinemia, less protein in the blood, and hypovitaminosis, means this one, hypovitaminosis means vitamins will decrease because the body is using fat, so the vitamins, the woman is not taking the water soluble vitamins because of dehydration, because of vomiting, so hypovitaminosis will occur. So biochemical changes in that, because of excess vomiting, loss of water and salt, and that will lead the fall in the levels of plasma sodium, potassium chloride, that will cause electrolyte imbalance and dehydration, that will lead to hepatic dysfunction. In hepatic dysfunction, what will happen? Acidosis, ketosis, and rise in uric acid, and after that hypoglycemia, hypoproteinemia, and hypovitaminosis will caused by hepatic dysfunction. Okay, so next is metabolic changes. In that, because of vomiting, what will happen? Loss of appetite. Because of vomiting, the woman, the mother will not feel of eating anything, she will not be interested in eating anything, that is loss of appetite. Okay, then inadequate intake of food. When there is loss of appetite, so the woman will not eat the food, the mother will not eat, that means inadequate intake of food, she will not be interested in taking the food, and that will lead the low intake of carbohydrate. So for the brain, and the carbohydrate is necessary for our body, for the brain function, for the energy. So when the woman is not taking adequate intake of food, in turn there will be low intake of carbohydrate also, that will lead to glycogen depletion. Glycogen is stored in our body, so the body will use glycogen for the energy, so that will cause the decrease in the glycogen level in the body, because no carbohydrate intake is there. That in turn, use of fat reserve. When there is no carbohydrate intake, the body will use the fat. There will be breakdown of fat for the energy. So use of fat reserve, the fat which is present in the woman's body, it will use that only for the energy. That will cause incomplete oxidation of the fat, that will lead the accumulation of ketone bodies in the blood. So when the fat is when the fat is used for the energy, when there is breakdown of the fat, there will be a chemical will be released, that is ketone bodies. Ketone bodies will be released when the fat is used for the energy, and that will cause the ketoacidosis. That is why you have seen that some people will go to dietitian for weight loss, so they will give them keto diet. So in that, what is that keto diet? The body will use the fat for the energy rather than the carbohydrate. So when fat is used for the energy, so more weight loss will be there. That's why it is called keto diet. So here, when fat is used for the energy, the accumulation of ketone bodies, it will lead to ketoacidosis. Okay, so next one is changes in circulatory system. Changes in circulatory system, because of vomiting, what will happen? Loss of water and salt. Because of vomiting, loss of water and salt, that will lead to hemoconcentration. There is one thing, that is plasma is present in the blood. The water content of the blood is plasma. So when the water is leak, when there is loss of water and salt, that will cause the thickness. Hemoconcentration means thickness of the blood. The more the blood will be more thick, and that will lead to increase in the hemoglobin percentage, rise in the red blood cells count, and increase in hematocrit. That will lead because of hemoconcentration. When there is less plasma, less water content in the blood, that will lead to increase in the hemoglobin percentage, rise in RBCs count, and increase in hematocrit. Okay. So now we will see the signs and symptoms of hyperemesis gravidarum. So begins by 4th week of gestation, peak at 8 to 12 week. Means the hyperemesis gravidarum, it occurs 4 to 6 week of gestation, means pregnancy. Once it starts, after 4 to 6 week it will occur, and more will be in peak, means more, this will occur more in 8 to 12 week, and it will resolve by third or fourth month of pregnancy. Third or fourth month of pregnancy, in the sense that that's why we are saying that it occurs in first trimester. So in third or fourth month it will resolve, it will go away, it will go. Okay, so that is, it begins in the 4th to 6th week of gestation, peak at 8th to 12th week, and resolve by third or fourth month of pregnancy. That means in first trimester only it will go away. Okay, it will get resolved. Then oliguria. In severe cases, oliguria means passing less urine. Okay, when there is dehydration, then it will cause oliguria, because through vomiting only this one contents are leaked out, the electro imbalance is there, so oliguria will occur. Then constipation. Already there is less gastro mobility, and when the fluids are leaked out, when the water is leaked out, so constipation will occur. Then appearance of palsy and jaundice in late stage. And in later stage, palsy means paralysis of the facial muscles, or we can say of the body, because of severe kind of dehydration and electrolyte imbalance. And jaundice can also occur then because of hepatic dysfunction. Jaundice can occur in late stage. Jaundice means the bilirubin, biliverdin, bile pigments will accumulate in the blood. Increase in the level of bile pigments in the blood will cause the condition jaundice. Jaundice means yellowish discoloration of skin, mucous membrane, sclera, so that will cause. Then features of dehydration and ketoacidosis. When there is dehydration and ketoacidosis, what symptoms we will see? First one is dry coated tongue. The tongue of the patient, of the mother, will be dry. It will be dry. Second is sunken eyes. Sunken eyes means we can say that dry eyes, and it will be little like this one, yellowish little bit. Then acetone smell in breath. Acetone is one type of chemical which is used in this one cleaning the articles or making of paint. It's having this one heavy kind of smell it's having. So that smell will come in the breath of the mother. Then tachycardia, increase heart rate. Then hypotension. Hypotension means decrease in blood pressure. Then pyrexia, that means fever will also occur. And nystagmus. Nystagmus means abnormal eye movements. Abnormal eye movements, because one complication of hyperemesis gravidarum is the retina, or we can say retinal damage will be there. Bleeding from the eye also can occur because of severe kind of hyperemesis gravidarum. So nystagmus can occur, means abnormal eye movements. Got it? So these are the signs and symptoms of hyperemesis gravidarum. Okay. So diagnostic evaluations of hyperemesis gravidarum. First one, we will do urine analysis. In urine analysis, what we will find out? The small quantity. The urine will be in small quantity. Then the color of the urine will be dark, and there will be presence of acetone and with diminished chloride, means decrease in the chloride level. Okay, so in urine analysis, what we will find out? Small quantity of urine, dark color of urine, presence of acetone and diminished chloride. Second is blood test. By doing blood test, what we will find out? Hypokalemia. Hypokalemia, that means potassium level, decrease in the potassium level in blood. Second, hyponatremia, decrease in the sodium level in the blood. Then hypochloremic, decrease in the chlorine level in the blood. So while through blood test we can find out if there is hypokalemia, hyponatremia, hypochloremic, so we can diagnose it hyperemesis gravidarum, that this is there. Okay, then LFT, liver function test. What we can find out? There will be elevation of liver enzymes. Liver enzymes, that means that SGOT. So those enzymes, there will be mildly elevated, rise in the liver enzymes, and also bilirubin level will increase. That will cause the jaundice. Okay, so while doing LFT, there will be liver enzymes will be elevated, and the serum bilirubin will also, the level of bilirubin will increase. That will lead to jaundice. And eye examination. So in that we have seen that nystagmus, we have seen that abnormal eye movements will be there. So eye examination also we are performing to check the any internal hemorrhage in the eye. Then ECG, as we have seen in signs and symptoms, tachycardia is there. So we are taking ECG, electrocardiogram, so to find out the cause or to find out the abnormality in the ECG. Okay, so these are all the diagnostic evaluations which we are performing: urine analysis, blood test, LFT, eye examination, and ECG. Next, we will see the management of hyperemesis gravidarum. First principle is to control the vomiting. To control vomiting is the first principle. Second one is to maintain or to balance the fluid and electrolyte. If there is electrolyte imbalance, we have to maintain that, okay, to improve the fluid and electrolyte balance. Third one is to detect the complication in early stage. Means if any complication is there, that we have to detect in early stage and we have to treat it properly. We have to treat that complication in early stage. So these are the principles of hyperemesis gravidarum management. Okay, so next is, in this hyperemesis gravidarum, hospitalization is compulsory. So we can't treat this condition at home, so the mother has to go to hospital. So in that, what we will do, first we will do fluid replacement we will do. So in that case, in fluid, that withheld, we have to withheld the oral fluid or oral food for 24 hours. That the mother should not take anything orally for first 24 hours, and in that time we have to provide the fluid electrolyte through the IV line only. Through IV line, intravenous we have to provide. And in that case, total amount of fluid, how much we are providing? 3 liters. Approximately 3 liter fluids we are providing to the woman. Among that, half, that means 1.5 liter, we are giving 5% dextrose. Half of 3 liter we are providing 5% dextrose, and half we are giving RL, Ringer's solution or Ringer lactate solution. So total amount, how much we are providing? 3 liter, half 5% dextrose and half is Ringer lactate solution or Ringer's solution. Then extra amount 5% dextrose. Extra we are providing 5% dextrose. How much? Equal to amount of urine. That means how much the person has excreted the urine and how much has went through vomiting. Means through urine and vomiting, how much fluid loss has occurred, that much we are providing by giving 5% dextrose. In this one, first is hospitalization is compulsory, and in that we have to withhold the person. We should not provide anything orally first 24 hours. Only we have to provide fluid through IV line. And how much fluids we have to give? Approximately 3 liters. In that we are giving 5% dextrose and RL, Ringer solution or Ringer lactate, and we are providing extra 5% dextrose equal to amount of urine and vomitus. Means how much the person has passed the urine and vomit, that much we have to provide dextrose. Okay, so these are dextrose and this one Ringer lactate solution we are providing to balance the electrolyte balance, okay, to prevent the dehydration. So next is pharmacological management. In that we are providing the antiemetics. Pharmacological management means what drugs we are providing. First, antiemetics. Antiemetics, in that first one is promethazine. Promethazine 25 mg. Promethazine, that you can see in brand name is there, Finargran is the 25 mg we have to provide. Promethazine, or we can give prochlorpromazine. Prochlorperazine, that we have to give Stemtil 5 mg. Stemtil 5 mg, or we can give trifluoropromazine. Trifluoropromazine Sequel 10 mg. We can give it as twice or thrice IM intramuscularly, or we can go for metachloropromide. So these are all antiemetics. Promethazine 25 mg, prochlorperazine 5 mg, trifluoropromazine 10 mg. BID means twice, DID means thrice, 2 times or 3 times intramuscularly, or metachloropromide. Metachloropromide, it's also one type of antiemetic. So these drugs we can provide to stop the vomiting. Then hydrocortisone. Hydrocortisone is one type of steroid. So corticosteroid drug 100 mg. Hydrocortisone we are providing 100 mg intravenously, IV in hypotension. if the person is having hypotension or intractile vomiting. Intractile vomiting means severe kind which is difficult to control. So intractile vomiting or hypotension, in that case we are giving hydrocortisone, or we can give prednisolone. Prednisolone is also used in severe cases. When severe cases will be there, then we are providing prednisolone. Okay, either hydrocortisone or prednisolone. And nutritional support. Nutritional support, as there will be nutritional deficiency we have seen in causes, so in that we should provide vitamin B1, vitamin B6, vitamin B12 and vitamin C supplements we should provide to the mother. So this is about pharmacological management. Second one is non-pharmacological management. So non-pharmacological management, or we can say at home remedies. So what we can do in that, in this case, ginger, cloves or fennel seeds. So the woman can use ginger, cloves or fennel seeds. That may be effective. That will be effective in controlling the nausea, vomiting. Second thing is that the woman should, we should provide the supplements. We should provide the supplements in the sense that folic acid, iron and vitamin B complex supplements we should provide to the woman to control the vomiting. Okay, and the woman should avoid the food, junk food and the food which is having more smelly food, or we can say beverages she should avoid, or cold drinks she should avoid, and with that case she can stop the nausea. If it's minor, then by using ginger, cloves or fennel seeds and by taking multivitamins, folic acid, iron tablets, it can reduce. And by avoiding the junk food and the food which is having high order or which is bad for health, or we can say which is junk food only, she can avoid. Okay, so this is all about pharmacological and non-pharmacological management of hyperemesis gravidarum. Now we will see the complications. If we are not treating it in early stage, if we are not providing proper treatment to the hyperemesis gravidarum in early stage, then what can it cause? What may be the complications of hyperemesis gravidarum? Okay, so let's see the complications. So complications of hyperemesis gravidarum. First we will see neurogenic. Neurogenic in that Wernicke's encephalopathy. Wernicke's encephalopathy, peripheral neuritis or Korsakoff psychosis. Wernicke's encephalopathy occurs because of vitamin B1 thiamine deficiency. Because of vitamin B1 thiamine deficiency, this Wernicke's encephalopathy occurs. So what it will cause? It will cause the mental symptoms like coordination. The gait coordination will not be there, abnormal movements, or we can say that we have seen nystagmus, that involuntary movements of the eyes, and so many symptoms it will cause. Wernicke's encephalopathy, which occurs because of vitamin B1 deficiency, and it will cause the mental symptoms, or we can say or neurological symptoms will appear, like the person will not have control on its gait and movement, and nystagmus, uncontrolled or involuntary eye movement. Second one is peripheral neuritis. Peripheral neuritis means numbness of peripheral nerves. Okay, peripheral neuritis means numbness of peripheral nerves like hand, legs. Okay, then Korsakoff's psychosis. Korsakoff psychosis is the advanced complication of Wernicke's encephalopathy. After Wernicke's encephalopathy, Korsakoff's psychosis can occur, which causes the more severe symptoms like disorientation, like confusion, memory loss. So these many symptoms it can cause. Okay, so these are the neurogenic complications: Wernicke's encephalopathy, peripheral neuritis, then Korsakoff psychosis. And second one is esophageal tear. Because of severe vomiting continuously, thus the burst can occur in the esophagus. The esophagus can burst. That is only esophageal tear. Then stomach ulcer. Because of stress, stomach ulcer can also occur. And lastly, jaundice. Because of increase in the bilirubin, biliverdin levels in the blood, bile pigments, that can lead to jaundice. Okay, so that is all about hyperemesis gravidarum. I hope you all understood, and please share the video to your friends. So thank you all of you.